Our medical society some 20 years ago noticed there were many in our community without access to health care. Hardworking people, but they did not have a company that provided health insurance, and they could not afford it. A meeting was called of physicians, hospitals, and volunteers to develop a plan. It was Project Access.
A lot of people believe that everybody has access to an insurance, but in fact, there are still many people who are left out and who don't qualify for financial support and are unable to afford insurance even through the Affordable Care Act.
These are working people. They work either for themselves or for companies that do not provide health care insurance. And they can't afford it on the jobs and the salary that they have.
All people need health care at some point in their lives. The reality of life today is that, the access to health care isn't readily available unless it's through an emergency room.
And this is where Project Access comes in. It is our physicians in our community coming together and volunteering their time, their energy and effort to make sure that patients who may not have the ability to pay still get the care that they need when they need. And really, I think of it as our way of honoring the humanity in all of us.
We were really blessed in Chattanooga that our 3 hospital systems came together from the earliest days of the program and met with physicians and agreed that they would collaborate with us to find a better way. And then 2 years ago, we were able to add the Tenova system in Cleveland to the Project Access Network. And that's why we now are called Southeast Tennessee Project Access. Project Access provides doctors and hospitals a better way, a more consistent way, a more compassionate way to provide the health care services that are needed for folks like our patient Stanley.
I have congestive heart failure. My kidneys don't work, so I'm on dialysis. My eyes, I was blind. Really, it's like looking through a dirty glass. Like the trees out here, I may see a green blob. And when it's gone, you're like, will this ever come back? What's gonna happen? How am I gonna take care of my girlfriend or my kids or my grandkids or anybody?
Unless you've been sick, you don't understand how important healthcare is.
The realization is that people are scared. They have no knowledge of what's going on. They're in kind of the worst shape of their lives and need sometimes reassurance, sometimes medications, and they need guidance. And so when we think about how scary that can be, the importance of what we're doing can't be understated.
He got me on the path with a Southeastern Retina. Man, oh man, those people are amazing. I have no idea what the medicine is or the treatment. I just know it works. And the people were nice. I ain't gonna lie, I cried. It was so powerful to be able to see. I could drive again and see again and see what a leaf looked like. I mean, that was a big deal. When you can see detail, that's awesome. Like my girlfriend's smile. It makes me happy to see that.
When people ask how you sustain a program for 20 years, I think the answer really is our physician community.
Providers of health care in Hamilton County want to be part of the solution and not the problem. I think they realize that by volunteering and seeing these patients that it's a win-win situation.
And it's a mission. The mission is to take care of patients. And so I think it's pretty easy to get people to come on board with this, to realize that, this is what we would all naturally want to do.
We've been really blessed, and we have 1,160 physicians currently participating in Project Access. As of today, we have coordinated $232 million of donated healthcare services over the last 20 years. And we have provided resources and help to more than 25,000 people in our community. And to me, that's really extraordinary.
I think we all who have had the privilege of studying medicine and being physicians have an obligation to pay back. And it makes me very proud to be a member of the Chattanooga-Hamilton County Medical Society. To see our society come to recognize the need and address that need, and to see the amazing results that have come about from that.
There's not anything more inspiring than to see a patient like Stanley's life really being fundamentally changed.
They're so full of respect and kindness. That is what I like.
I salute all of you who are participating in making Project Access so successful. Thank you.